Hi, everyone. Welcome to the 50th episode. I can't even say that with my mouth is I can't even get it out. It's unbelievable. But this is the 50th episode of Misconceptions. And many of you who've been listening know that I am a therapist and I really feel very passionate about bringing information about perinatal and reproductive mental health to the broader world and especially to Jewish women in the Jewish community. But there are many other people who I work very closely with, and I would like to introduce them to you. This is my extraordinary team of Dvora Entin and associates, but really these are my friends, these are my colleagues, and these are the women and one man who hopefully will join us shortly, who have committed really their professional careers and lives to help others who are struggling with perinatal and reproductive mental health. So I am honored and privileged to welcome my team to this conversation. Welcome to each and every one of you. We are going to unmute and mute as best we can. It's always fun to navigate a large group environment, but have asked our clients if they are willing to share with us some of their questions, some of their kind of curiosity, either about us as therapists or about perinatal and reproductive mental health. And we are going to have this conversation with you today. And I hope that you find it as interesting as I think it will be for all of us to be in discussion. So let us begin with, for those of you who are auditory only, I just am going to list off to you the people that are on the screen. And I'm going to do it just in order of what I see in front of me. I welcome Dr. Talia Hindin, who is joining us from Israel, Sarah Lakatz, who's joining us from New Jersey, Dubby Flam, who's joining us from Florida and Jersey, Suri Weiss, who is joining us from Muncie, Hannah Kraus, who is joining us from Florida, Gitti from New Jersey, Shifra from Atlanta, Georgia, Chaya Cohn from New York, and Yaakov Rabinowitz, our single male who joins us here today, also from Atlanta, Georgia. Thank you for being a part of this amazing, amazing team. So I want to start, and you could just raise your hand or I'll call on you, but I want to start with, what do you think are the top issues that maybe I'll say that frustrate you the most or that need more air, that need more conversation relating to the population that we work with, the perinatal reproductive population? What are the things that make you just go, oh, I'm so frustrated, or oh, there needs to be more information about this, or just like the things that make you maybe stay up a little bit later at night or worry about the clients that we serve? Who would like to start? Who'd like to begin? Shifra, why don't you start? I'm going to call on you. Go for it. We don't have your audio for some reason. I'll come back to you. Chaya, why don't you start with that?
So, what I find the most frustrating and what I keep seeing and definitely pulls at my heart is this gap of understanding that the family has on postpartum and prenatal and understanding, how one's mood and symptoms and how that can affect the whole family dynamic. I think there's a lot of misinformation out there, and I see that a lot with the individuals I work with, and it's definitely been very difficult to say, okay, let's provide some education so you can understand what's going on, so we can help your family understand and your husband understand and everybody together, because it doesn't just affect the individual, it affects everybody.
Yeah, absolutely. Sorry, what are your thoughts on that?
Yeah, I agree to what Chai was saying. I also noticed that the isolation aspect of feeling alone in the experience is just like so significant. And many people compare themselves always to what they see in others. And I sometimes remind my clients of like when you walk on the street, people don't see your struggle either. And it always feels or seems like everyone is managing amazing and everyone is doing so great. And I'm the only one not managing, not like it makes people feel less than or inferior in their struggle. And just, I think, support and understanding that others might experience something similar can be helpful. One other thing that I find like a common trend that I see with my clients, that many women who are struggling with postpartum, not all, but many struggle in their relationships.
Hmm.
And that's also an element of isolation because if they have their partner at least be there to support them, then they already feel like they're in it together. And sometimes it's just a lack of education and sometimes informing the husband of helping him understand what his wife is going through and experiencing and how he can better support her can be very helpful and
Yeah.
sometimes work in the relationship.
And I think also, when you bring up that question of isolation, that's something that actually we heard from multiple clients of ours. Could you talk about the isolation? So I think we can definitely come back to that. Shifra, is your audio working now?
I think so. Is this
It
better?
is. It is. It's
Okay.
working. What are
So
some of the things that you're seeing?
there's two things I would point out. One is the deluge of over information and misinformation from social media, that people come in with like, here's what I have, and getting really a little more nuanced helps is actually something very different. And then something else similar to what Suri said, which is a lot of people wondering, how is everyone else doing this? There must be something wrong with me. I'm the only one who's struggling with XYZ, not just this particular situation, but I see everyone else, someone else dealing with the same situation, and they're managing much better than I am. So kind of, I would call that comparing my insides to someone else's outsides.
Ooh, I like that line. Comparing my insides to somebody else's outline. Okay, that's a
You
great
might
one.
make it up, but I don't remember where I got it
It's
from.
but it's a good one. Yeah, absolutely. And I think that social media is promoting that. And here we are on, so, kind of promoting our stuff on social media. So I recognize the curiosity in that. But absolutely, that comparative experience is something that I think every one of our clients struggle with. And maybe, could we be honest, that we probably struggle with as well? I don't know about you, but as a therapist, I'm like, I need to put out more material. I need to be more engaging. I need to be blah, 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 blah. Like, we're always thinking about the more that we're supposed to be considering and doing. Talia, what about you? And maybe you might also give us a little bit of a perspective of things maybe a little different in Israel, where, many of the women that you are working with are struggling with different aspects of motherhood.
So I think the first thing I would say is almost the opposite extreme sometimes of what Schiffer was saying, is that sometimes there's such a dearth of information. If women knew what might come upon them after giving birth, knew what to look for, knew symptoms, signs, and they could identify what was going on for them, then they could seek the help that they really need sooner, rather than going through the process of what's wrong with me, I'm crazy, the isolation because I'm the only one who's crazy. But just also that feeling of I don't know what's going on for me. And if people around them also have no information, then they can't help them find the support and get the support, which is so unfortunate because there is support to be had. And so kind of also like bridging that gap, and how do we educate doctors, educate their clients or their patients, and really kind of thinking about how do we disseminate that information in a way that is accessible and it doesn't feel like a deluge to people and is going to be helpful. And I guess kind of in thinking about the broader picture in Israel, is just the baseline level of anxiety is already elevated for so many people. So you add on top of that not sleeping after having a baby, or if there are any postpartum challenges, you're not starting from a lower baseline that I think many women are. So everything feels bigger, feels exacerbated and elevated. And so I think we're kind of challenged with addressing so many different pieces of the puzzle that just feel so much bigger.
Yeah, absolutely. Dubby, what about you? I would just like to give a shout out. Dubby is my first associate, first one who came to me and was like, "Do you want to make a private practice like with other people in it?" And I was like, "No, I have no desire to do that." And she's like, "Why not?" And I went, "Good question. Why not? Need to think about that." And so Dubby is the one who actually pushed the creation of Dvora Entin and Associates. And so once again, I thank you for creating that and pushing me past my moment of like, "What the heck am I doing?" So Dubby, what are the things that pushed you into this space?
I think really what the others have already shared. There's this significant sense of a lack of community, as I've shared, several times in our group consultations, is really the lack of community, support, lack of community in terms of people even just sharing with one another about what's really going on. Um, and the other thing too that I've kind of just started to see and learn is the significant amount of pressure people feel. I know certainly in the community that I was a part of, there was a very significant sense of, okay, returning back to work 6 weeks postpartum. Even though they're allotted technically 4.5 months, they all go back to work 6 weeks. And the significant sense of overwhelm and significant sense of isolation. I can't, if I don't go back, right, my boss is going to fire me, but I'm really not doing well. I'm really struggling. I feel so much pressure to think about having another one when I'm only 6 weeks postpartum. So I think really overall is again, isolation, lack of support, and lack of resources.
Yeah. You know, one of the things that I'm thinking about as you're saying it, and I want to segue a little bit further into this discussion of a question about community, the building of community. And what's interesting to me is I've heard presenters say things like, we just have to like, more meal trains and more support and more community and less isolation. But when I ask you what that means to break that down, I think when I look around the world or my community, I see everyone's doing the same thing, meaning everyone is having many children, some of them having them very close together. There's extraordinary, everybody has responsibility. And I don't know about you, but if I have to go cook a meal for somebody else, to be very honest with you, my children are having peanut butter and jelly, right? So I can make you a very nice meal, but I learned very early in my life that that was not the thing that I could do as a supportive friend and community member. And so I think about the pressure of we should be a strong and healthy and collaborative and supportive community, but we're all in this muck a little bit. Like we're all in the hard stuff. And so I guess it's I think we talk about this idea of support and connection and reducing isolation, but I'm wondering if I could ask some of you, what are your thoughts about what that actually could look like when everybody's doing the hard stuff together? Like I don't have time for fill in the blank. Get you, what do you think?
Yeah, so I think it's more than just like providing the resources and the meals and everything that we're talking about. It's really lowering the expectations for the women and normalizing that it's okay for you to put on the table peanut butter and jelly, and it's okay for the laundry not to get done today, and it's okay not to show up to the simcha or some event that you need to go to, and it's okay that you do look 25 pounds heavier than normal. So I think lowering the expectations and also bridging the gap between what women really think motherhood is like and what it actually really is. And I think, Devorah, I'm just going to add this here because I think you were the first one that brought this to my attention in school. I think this was one of the papers that we had to write in your class, and it was what were your expectations of motherhood and what is the reality of motherhood? And that was like it got me really thinking because I think everybody goes through that. I don't think we are educated enough. We get to see it either with our mothers or our siblings or our neighbors, what the messiness actually looks like. And I think rather than providing all the things that mothers think they need, it's lowering the expectation.
And I think also part of that is the challenge of what is being kind of sold to us publicly, right? You said like the inside and the outside. And so if what's coming into our doors, for those of you who are taking some of the religious Jewish magazines, I will always go after that. On one hand, there's good information and knowledge out there often about mental health issues, but what is being shown to us is this standard of reality that is not a reality. And I just think about like that I can maybe be discerning about it, but there's still going to always be a part of me that's like, wow, other people's homes look like that and their tables look like this and they're organized, or then they have organizers in their closet doing that. Like, oh, I know, I never had that. I never do, I didn't do that. And so for me, I think, if you are discerning, you're able to say, okay, yeah, that's not really real. But if you're struggling, I think it shows up in a different way. Sarla, what are you seeing with your clients?
So definitely the expectation level is way too high of how people should be functioning after they give birth or just going through different mental health struggles. I think um, the guilt around not being what they're expected to be or what their expectations are. I just think as a community, we have to lower, again, like what Kitty was saying, like just lowering expectations and also sharing more. What I'm hearing a lot from my clients is they're going to shul, they're going to talk to their neighbors outside, and they don't hear anything but like, we're doing well, we're doing great, everyone's good. And then it just makes them feel so lonely if they didn't have a great day, if their lives don't look, all neat and organized and everything else. I think people should start sharing more about the reality and it's not complaining. I think there's a difference between people are like, I don't want to complain, it's a good thing or whatever. I feel bad complaining. It's more just about being honest. It wasn't such a great day, or, the baby was up the whole night. He's not sleeping. Just being honest about what postpartum could look like could really ease the isolation without doing much, like just with making it more normal.
Debbie, what do you wanted to respond to that?
Yeah, I just wanted to use a great line that Casey Davis talks about in her TED Talk, where she says cure tasks are morally neutral. And I think to get these point where she talks about lowering expectations. And a lot of the support groups that I facilitate, the number one thing I hear is the amount of guilt, significant guilt that the women share about not cooking dinner for their families. And it's so tragic how we tie value to something as simple as cooking dinner.
Okay, so I have to ask Yaakov because being you're going to be our our identified male in the group here today. You ready? I would like to hear from you. We're talking about all of these expectations of women. Do you think men have the same level of pressure and expectation of fatherhood or of parenthood in the way that we're discussing this about the women that we're serving?
Oh, but I think many of them feel that pressure in, I don't know, what's husbandhood? I don't know what the right word is for that, but in being a spouse, a supportive spouse. And it's funny that it- what I most often see in kind of my work is that when their wife is struggling, so their first instinct is to lean in, is to be supportive, is to try to take more and more. And if all things go well, then that's great, and people recover, and then things get back to normal. But then when that isn't the case, when we're dealing with postpartum depression or anxiety or a really or some other emotional struggle in the aftermath of adjusting to parenthood for the first time or the second time or third time or whatever the challenge is, that all of a sudden get that message of this is not enough, you need to do more, or this is not being appreciated. um, that oftentimes can is part of what leads to real struggle and challenge in the relationship. um, and yeah, kind of creates a lot of area for help and support
Interesting.
and
It's come like
realignment.
kind of like more like vicarious, more. It's not that they themselves feel the primary pressure of the postpartum or expectations of others, but it's more about the expectations from their spouse. It's what their spouse's expectations are of them or of what it's supposed to be like. Is that what you're saying?
Well, so that's part of it, but I think part of it is from them. It's saying that if I take care of my wife, then she'll be okay.
Yeah.
And when she's
Yeah.
not okay, then what does that mean about
hmm
me as a husband?
Yeah.
And that's an area where a lot of people struggle.
So, if it's okay with you guys, I would love for you to get just a little bit personal, recognizing that we have a very public audience. But I'd like to know what was your greatest surprise about the postpartum experience, right? Like, I'd love to know if you would be willing to share, what was the thing that shocked you the most? I like that Gitti talked about like the challenge of expectations, like the matching of expectations to what reality was. But who would like to start? If you'd be willing, you don't all have to do it, but if you would like to share, what was the thing that surprised you the most or caught you by, kind of, I didn't see this coming in dealing with postpartum or perinatal mental health of your own stories? Go for it, Shifra.
I can start. There was a lot of things. There were the isolation. I had a significant postpartum depression after my children were born and while I was pregnant. And so the isolation and feeling that nobody understood what I was talking about was very surprising. I was also surprised at how sensory of an experience it was. Like, I've been around babies my whole life, like messy, dirty, wet, the like sensoriness of it felt like an added layer of yuck that I was not prepared for.
Amazing. Okay. Yeah, Gitsi, go ahead.
So I think, I mean, not I think, by my first few kids, I was still teaching. I was a high school teacher. And I remember, being in my ninth month, and there were some other teachers that were out for maternity leave. And a teacher came back after 6 weeks, and she's like skinny and happy. And she looked like she had it all together. And she's going into the classroom and she's all prepared. And I'm thinking, okay, like, what's the big deal? I'll have to do the same. And then I give birth, and it's 6 weeks postpartum. I'm like, how? Like, how exactly am I getting two kids to a babysitter? How am I fitting into clothing? How am I preparing a lesson? Walking into the building, making believe everything's fine, when really inside I am so not fine. And I'm thinking, how exactly is this supposed to happen? And I did get 6 weeks. So, am I crazy? Is the system corrupted? Like, what is really going on here? So that was really hard to really, again, back to the point of is expected of us, the pressure that's put on us, and really what the reality is. I think now, 20 years later, I would be less hard on myself. But as a young mother, watching everybody else just segue and swing back into life, it just puts a lot of pressure on us.
Yeah. Hannah, what about you?
So it's actually interesting because as Goody speaks, I'm reflecting on my own first postpartum experience. And I actually had quite the opposite experience in which I chose to take a step away. And really, I'm somebody who constantly pushes myself. And it wasn't even a conscious effort to take that step back. It really just was the way that circumstances came out and how much I struggle with that. And I was so surprised with the emotional upheaval of not being able to accomplish. And being with my child and all the questions that that brought up in such a new kind of forum of my life that, pulling back on your, like referencing back to your question of like, what are you noticing clients saying? And a lot of it is like, I didn't know that my life would look like this. I didn't know the ways that it would change. And a lot of the conversations I have are around the grief and loss and like how much is truly changing in that time. And when your life circumstances are also so, I guess, in the lack of alignment with what you expected in your personal life and then throw a baby into the picture, it really brings up a lot of challenges to the internal psyche that I think is so important to reference and to discuss.
Can I ask you something? Do you, and I'll come to Chaya next, but I'm wondering, do you have a sense of how long it took you to reset, to kind of to reset, to put yourself back into a place of like, this is the new me now? Do you have a sense of time?
I do. It actually took me a year plus. It
Yeah.
really was, and I have a sense of this actually later on. I didn't even know it at the time. It's when I really reflect back on the experience and follow my own journey and also obviously the work I do with my clients and gaining all of that kind of perspective that my clients teach me so much. So they teach me about their own experiences, but they also teach me how to look back and reflect on my experience. That's part of what makes me a therapist and what I enjoy bringing into my work. So it's really given me the opportunity years past of like, oh, I was okay then. Like at that point, like I think I would say between 12 to 18 months postpartum, I was like, okay, this is what I should be doing. And all the should be's are I use that word very carefully here. But that's when I reached that point of like, aha.
Yeah. Hi, what about you?
So interesting enough, I thought I was preparing myself for my first child. I have a few children, and I already had a lot of nieces and nephews, and I'm like, oh, I got this. I know how it goes. And I was already a practicing clinician. The thing that shocked me the most and is how much it changed every relationship that I had. It changed
Mm.
my relationship with my husband. It changed my relationship with myself. My body wasn't my own. I had to get comfortable, find my footing again for my own body, emotionally, physically. The whole shift in your family, your intimate family dynamic and your relationship with your husband, that was a huge shift when you first have children and you give birth. And I think something that is, kind of not so much talked about is the trauma that occurs in some of the births, right? The traumatic events that occur. My first child, when I gave birth, was very traumatic, very traumatic. And I couldn't understand why everybody else they didn't talk about it. Nobody else thought, they were like, oh, the epidural worked, this worked, that worked. It was beautiful. It was so beautiful. And I'm like, I was so afraid. I was scared. The doctors were running back and forth. They weren't communicating with me, and it was very hard. And I felt that, I think Hannah, you said that too, and my other colleagues have said that. It was very isolating, feeling like I was alone, and I had to figure out how do I be a wife, a mother, a working mom. I had to go back to work after 6 weeks. How do you manage it all? How did everybody else do it? And I had to learn. I had to learn how to recognize the new me. Talk about grief, right? And you're grieving your old self, what you were before you gave birth. You're a new
Mhm.
person, and it's not a bad or good thing. It is a change. You are a new person after giving birth, and that was a very hard shift.
Absolutely. Absolutely. Talia, what about you? What was the thing that surprised you the most about postpartum?
So I think, like Chaya was saying, that I was a practicing clinician already. I wasn't such a young new mother. but there was this fear of ruining any attachment that I created with my baby. Like, I can't let her scream because then she's not going to want to see me in the morning. All my friends, I would hear them talk about sleep training their babies, and it's okay to let them cry. I'm like, but then they're not going to want to see me in the morning. I can't let them cry. And kind of really learning what attachment means to babies. There is that, even if there's that automatic love or connection, whatever that looks like is different for each person, but kind of recognizing, like, what does that look like between the two of us as we get to know each other and work together and figure things out, and that it's okay to let a baby cry. And what does that mean for me? What does that mean for the baby? Probably different things. But I remember calling my mother on the way home from work saying, oh my gosh, I'm ruining my kids. Like, I can't do this. I have all these clients who are so much younger than me and are pulling it off. What am I doing wrong here? Kind of like, growing into it. And it takes time. And I think people also don't always tell you, like, it takes time to fit into motherhood. It feels like you give birth and you're just supposed to snap into it, like, natural process. And not everything works out just as naturally as you would have expected.
I think that's one of the themes that comes up so frequently. And in some ways, I think is maybe a little bit of a pushback from the previous generation, where the previous generation, I have heard that generation say to me, like, why is this a thing? Like, why is this such a big deal? This is what we did. This is what we all do. This is how we all did it. Like, it's not, why are you making it out to be so hard and so difficult, right? And I think this is what we're pushing back against, this idea, like, just because it's quote unquote natural, normal, healthy, meaning having babies and growing our families, if things go according to plan, there's still a part of this that's incredibly difficult, that has grief, like Kaya described, and like Hannah mentioned, this idea of, like, there are parts of this experience that are incredibly challenging that many of us, because we never talk about it, we really wouldn't know about. And therefore we get into that shock and, like, what just happened to me moment. I think that part of the education knowledge could be helpful. The question I have is always when is that education knowledge going to happen, right? Most of us are not going to be comfortable hearing that in college classes and are going to be like, yeah, but that's not going to be me. Like, that, I'm going to be fine. I love babies. I want to have tons of kids, right? And so where does the education experience actually happen for new and potential mothers and parents as they progress into this new experience? And maybe it's always going to just be catch up. I'm not sure, but maybe it is, training as we become grandparents eventually, right? When we then parent our adult daughters and children, that our voices will sound different than the generation before ours. I wanted to pivot a little bit, if you don't mind. I wanted to bring up some of the questions that we heard from our clients, and some of them I thought were really fabulous. I would like to shift a little bit over to the therapeutic relationship. So one of our clients said that she was talking about the paradox of the therapeutic relationship, the idea that it's one of the most intimate connections experience, and yet it is accurately restrictive, right? It's appropriately restrictive. It's constrained, and between sessions sometimes feels anxiety provoking or even disorienting. I understand that these boundaries are meant to protect me and preserve the work, and yet the experience of such intensity combined with such limitation feels unique and at times painful. Intellectually, I can appreciate the necessity of these structures, but emotionally, I struggle to metabolize the complexity. From a clinical perspective, how do therapists conceptualize and hold these paradoxes? So basically, I'm curious about the therapist's view or how they feel about the power and vulnerability imbalance, and what can help us as clients not just tolerate it, but perhaps even grow from the tension between intimacy and limitation, connection and power imbalance. So yes, we have some incredibly erudite and smart clients, which is always such a privilege. I think what I find so interesting is I was recently at a wedding and an associate of mine said, we were talking about meeting our clients at Simchas. And she said, I went somewhere and I decided I saw my client and I just felt uncomfortable for her. So I left. And I don't know about you, but when I see a client, I sometimes feel uncomfortable, right? There's something very public about being a therapist and knowing the very deep internal workings of other people. There's something very intimate about that. And so to see you in a public space feels disorienting to me as a therapist. I'm wondering what each of you experience, how you experience that. I love seeing people in other states. That's why I'm licensed in several other states, that I don't have to see you in Shul. And that's very intentional. My husband's the principal of a school. So not having my kids in their classes, right? Or not having to see them at teachers' meetings and things like that. That's helpful to me. I'm wondering how you experience this therapeutic relationship, what you find challenging about it, or how you conceptualize it. Who wants to start? Suri, you want to start with that?
Okay, so when I was reading this question, I have a lot of appreciation to this question. I think it has a lot of depth. And it really made me think of like, is this something that is just inevitable? Does this mean that good work is happening? Like, it really made me think more about it. Um, in terms, I think creating space for the client to talk about it, to talk about this reality, and hearing closely what it is for them. And maybe for different clients would need different things to help them navigate this. Like, I very much appreciated how the question was phrased of like intellectually understanding that it's necessary and even good and protective, but emotionally having a hard time to metabolize it, or and it can even be disorienting. And both can be true.
Yeah.
And I think just sitting with that and validating and understanding the client's experience and maybe exploring of like what can help the client while keeping the boundaries in place.
I think that part is the most important piece, that while keeping the boundary in place, because if in theory, what would help that client is me being more disclosing, that is not appropriate within the context of the therapeutic relationship, but yet in theory could be helpful to her. But we want to acknowledge that the keeping it in place part is still valuable and necessary according to our training. Yeah. Dubby, what do you think? I saw you wanted to add.
Yeah, no, I wanted to add that unlike you, Devora, where if I'm in the grocery store and I see a client, I'm the one who's going to be hiding behind the aisles, not them. Um, and I think for me personally, I really strive to come from an egalitarian perspective where I really don't see it as a power imbalance, right? But more so really that we're here working together as a team. And I would just add this one very important piece that I think all of us here in this space will agree that just because the session ends at 11:50 or 11:55 or 12 o'clock, I promise you we are thinking of you beyond that space. When I go to
Absolutely.
the store and I see something and I think of, hey, so and so told me that they like this, I'm thinking of that all the time. My clients are on my mind.
I really, really honor that. And I think that it is 100% true for all of us. It is not possible for us to leave the work. It's not just the work, right? We're dealing with human suffering and human souls and people that could be me and that could be each one of us. I think we feel that very, very deeply. I'd love to come back to that idea, that comment as well. Absolutely. Shifra, go ahead.
I think that what people are pointing out about how it works best for the client is such an important part. And I'm sure that everyone else will echo this. I had one client who told me, I don't want to know anything about you or about your life. I really like that you're not a real person. And I thought that was such a fascinating use of language because it's virtual. So I'm just, I'm shoulders and up. And I'm not in her community. She's never going to run into me. And how valuable that was for her to just have a space where she doesn't need to do any caretaking for the other person. On the other hand, I actually had this yesterday where a client called me, a former client. We terminated a therapy about a year ago, and she was calling to invite me to a simcha she was making, which had been part of the work that we were doing, was preparing for the simcha, and how her fear is now gone, and just now she's through the other side, really want to be a part of her life in that way. I think it's so beautiful. It's also very fun when sometimes clients will send me memes or reels that reminded them of something that we talked about in therapy, and how that's one of those just individual points of connection, which it's disclosure, but it's not like it's connection without being oversharing. I think it's for every person, it's going to be a different spot.
Yeah, it's so interesting as well, Shifra. I have actually, I have a client who has taught me that one of the things that's grounding to her at the end of session is to talk about something else. So she'll say to me something like, talk to me. And so I'll just think of something that's of interest. We are both professionals. We are both, competent, very highly competent people. And I'll just share something with her about my professional world. Or even it might be something of like, she knew I was away and I'll say, I had a really nice vacation and I went here. And with most clients, I'm not disclosing that personal information, but for this client, there's something about that kind of humanity-based connection, human to human, woman to woman connection that is grounding to her. And so I've chosen within the structure of this relationship, I have chosen a little bit of gray in terms of disclosure, but usually it's professional. Like I read something interesting or I'll share something I saw that I'm happy to just chat with her about for the last 5 minutes because she has expressed to me that that helps her feel safe and grounded. And I think that that also, like reading the experience with our clients and helping them help us, be in a safe and connected relationship is not actually something, by the way, that they teach us in school, right? I think that's something that's very, very, very nuanced. They teach us about disclosure. This is not about disclosure. This is about human connection and about, real life. And I will, there are some women that I've worked with that are in my soul, and we've talked about, I will meet you and how would you like me to treat you? And so we've discussed it. And the primary way I treat them is the way I would treat everybody else. Hi, how are you? Good job. Oh, baby's so cute, and how was your summer? And because she's in a crowd. And so it would be normal for me to schmooze with all the women in that crowd. So I think like learning from our clients also a little bit more about what they need can also be helpful as long as within the structure of that professional relationship. Who else wants to comment on that? Yeah, Gitsi, go ahead.
Actually have so many thoughts on this question. So maybe I'll just bring out some 2 points. I think, Dvora, what you were saying is I think there's a difference between self-disclosing and being human. Like there's something about being a human being in the room and then talking about your personal life. And I think it's important for our clients to see our human side and to see that we also have struggles and we also understand them. So saying things like, when I hear you say that, I could actually feel chills in my spine versus saying, oh, when I hear you say that, it reminds me of my sister that also had a stillborn. Like we don't have to share private information, but we could still be our human, our very selves, and that's very comforting, and it's still with limits and boundaries, and hopefully it could give the client what they need. Another point, if I could just add on this topic, on this question, I think to what Suri was saying earlier about people struggling postpartum or with maternal health and how that affects their relationships. I think role modeling to our clients that you can have an intimate, safe, connected relationship with somebody that has limits and boundaries, we could role model a healthy relationship and they could carry that over into their regular lives. So we really are this really is in the best interest of the clients on so many different levels.
Yeah, I totally agree with that. And I think, good supervision, right? Collaborating with colleagues to make sure that we are staying within the bounds of our professional, kind of hats. But I do want to come back to that idea, like Dubby speaking about the idea that we take you home with us. I'm home, but like we take you home with us, right? What that's like for us in terms of, I find it very difficult to do sessions in the evening anymore because I have a hard time going to sleep after that session, right? Because those sessions are intense or complicated or emotionally laden. I can't just like jump up and go to bed, right? Or I'm not going to be able to. So these things impact us. Sarla, do you want to address anything about the question that the client was asking us?
Yeah, sure. Something on what you were just saying just before. Definitely the sessions at night. Like I definitely need time after. Like the session doesn't just end at 9 o'clock. I definitely the nights that I have sessions, my sleep is not the same. Like I definitely reflect and I need time and to collaborate or to, have a call with an associate or something like that because it definitely like we think about our clients more than just during session. We think about how we could better support them, how we could help them even more. And I think that's part of our jobs, part of our careers. And regarding the question, I think it's a great question, such a valid question. The therapeutic relationship is just so unique. It's really unlike any other relationship, and I think it takes time to get used to that. I think that clients that are starting therapy for the first time, it's going to feel very strange in the beginning and very anxiety provoking from week to week, like not having that, typical connection during the week, a text message, an email for some of my clients that have a hard time with that, if there's something important that's happening during the week that they're nervous, they're going to forget for the next session. Like I tell them, you could email me, I'll read it and then we'll discuss it during the next session. And I think for some clients, it's helpful to just have that for their anxiety, just to know that they email me, I've seen it, and we're gonna discuss it. Like, we're not
Right.
forgetting anything. We're not gonna like leave out anything. But I definitely think it just takes time to get used to the therapeutic relationship.
But I would say, Sarah Love, that, and I think it's important to recognize that that idea of connection between sessions, some will use that as a therapeutic tool, and some will say that that would breach a therapeutic boundary. And really, it's up to each of us as clinicians to say, like, is this working? Is this a boundary that I'm comfortable with kind of, softening a little bit? Is it something that's valuable in the therapeutic process to have that ongoing connection? I have personally seen more difficulty with it than benefit with it. And I find that, like, it's one of those things where, like, I like what Gitti says about modeling a safe and structured relationship. And I think sometimes that idea of, like, nope, these are the rules and we're consistent in the rules can help people realize that I can still feel connected to this person. I can see that this person cares about me. And also, the structure of a healthy relationship rule is consistent, which for some people, they don't have that in their lives. And it can be pretty
Right.
powerful. Yeah,
Right, for sure. It's very unique to each like client, their situation, their what they're dealing with for sure.
absolutely.
And yeah, and the
Absolutely.
therapist.
Talia, what were you thinking?
So I think, yeah, I was thinking about taking what you just said almost one step further of, can I feel connected and supported by someone that I don't know so much about? Can I really feel heard and understood, even if I don't know if my therapist has gone through the same thing? Often clients will want to know, well, did this person go through this? And we will never have gone through every situation that will walk through our door. And I think that's part of that conversation of what's it like to be heard or to feel heard and understood and supported in this space without knowing everything about me.
Yeah.
Can you still feel that connection and that support and empathy and everything else that we hope our clients are feeling from us without having that background information?
And I think that that's I know that's one of the things that comes up for me in training all the time is people ask, like, what about self-disclosure? And do you tell people what your story is related to infertility or maternal health or reproductive losses? Like, what do you share and what do you know? And I think that I know I've made a choice from the very beginning not to, but for the reason of there is no way that I can share the same experience of you, but can I effectively show you that I can show up for you authentically, humanely, and from a humanity perspective, that you will feel seen and heard and connected with me, not even knowing what my background is. Yeah. I want to kick this over to Yaakov. Yaakov, what is it like for you in terms of taking it home with you, but also what's it like for you in that therapeutic relationship? And most of the clients that you're seeing are male.
Yes. So to me, there's a couple parts about the therapeutic relationship. The first one is, we talk about having boundaries and how this is important to protect the client. Um, I guess the way that I actually view that is in a normal non-therapeutic relationship, with some limited exceptions, there's a give and a take. There's this, kind of uh, healthy relationship is one in which both people are investing and sharing and contributing. Um, and the therapeutic relationship is designed to be very different. Um, it's designed for one person to come and support the other without
Yeah.
asking anything back, without asking for reciprocation, without asking for acknowledgement. Um, and and it's so easy if, again, I happen to be a little bit more loose with with some aspects of self-disclosure than other therapists, but the trap that comes with that is turning about you, about like, oh, how am I doing? Well, let me tell you about my week. And then all of a sudden the focus and the shift of being able to help and support this person who's struggling and needs your help is lost or diluted in some way. And there can be, now you're dealing with this complicated balance of how does you keep the focus on helping this person, helping this patient, as opposed to them feeling the need to reciprocate in some way. And which leads into the second part of how I conceptualize this balance, which is this is very uncomfortable for some people. There's this, whether it's this need, like, oh, how old are you, and have you had this experience, and how can you help me, without these things, or how can I open up to you without knowing about you, without having that reciprocated back, and in which case, what I see there actually is this, really that anxiety or that fear in which we have the opportunity to help that usually that's not isolated to the therapeutic relationship. That is coming from somewhere and their other life challenges and other, experiences from their growing up and their family of origin. And this becomes the therapeutic relationship, whether it's setting boundaries or whether it's, kind of pushing people to learn to trust, to open up, to let go of control. That this now becomes a way that a model rather for them working on how do you deal healthfully or in a healthy way with the other relationships that we have in life.
Absolutely. Absolutely. I will say, by the way, that's one of the number one questions I get asked is, but she looks so young. I'm like, no, I mean, I literally say that about all of you. I'm like, no, she's much older than she looks. I'm like, it's fascinating how people are really struggle with like the age of the, I get it. I mean, I totally get it, but it's a pity I hire all very young looking people. Gitsi, go ahead.
Yeah, I just want to point out, I think it's important for the women listening here to really understand a little bit why is it that we keep it to a limited, structured,
Yeah.
boundary relationship? Because I don't think people really understand the ramifications and the toll that it would take on the relationship if we would share our background. So I don't know
Yeah.
if you want to open this up or go on to the next thing,
You can,
but maybe,
why don't you give that as a,
oh, go
yeah,
ahead.
we're running out of time because of course I knew we wouldn't get past one
Oh.
or two questions, but what do you want to answer to that comment? Like, what would you like people to know?
Yeah, so I think that I don't think women realize that if they would know about their therapist, they would carry a lot of emotional weight that they should not be carrying because the time is theirs and they're paying the therapist to be there for them and to sit with their emotions and not vice versa. So just to give you an example, I think I remember, I don't know how many years ago it was, but one of my clients had a stillbirth and my sister had a stillborn the same day or the same week or something. And I said it to the client. I said, oh, my sister just had, and for the next few weeks or the next few months, in every single session, my client would ask me, so how's your sister? How are you doing? How are you supporting her? And that wasn't really, I mean, it was nice of her to ask, but why was she carrying what I was carrying? I'm into carrying what you're, I'm meant to sit here with you in what you're carrying. So I don't think women realize what it would look like or feel like if we actually
Mhm.
would share. And it's just
Yeah.
important to know that.
I think that's important. And the way that I experience also is this idea of like comparative suffering. I find that it's ineffective because most women will be like, okay, but that's not really like, okay, but you can't really understand because you only had to do this kind of fertility treatment versus that kind of fertility. Or you never experienced a late term loss, only a mid trimester loss, right? That people are very quick. Comparative suffering. I believe I learned that from Brené Brown, that term, right? And so it's like there are people's perspective of like, you cannot understand me because you do not understand my story. So if I just neutralize it and say, I'm a blank slate to you, other than to say that I have knowledge and training and education, then my hope is that that will be enough to connect to you without you having to align your story with mine. I don't know if you feel similarly, but it's a good question for us to come back to. I want to end our conversation today, and I have a feeling we're going to do this again because there's so much more here. But I would like to end our conversation today with if you could identify one misconception that people hold about either maternal or reproductive or the therapeutic relationship. What is the misconceptions that are out there that we need to blow up and get rid of within our society? Talia, why don't you start? Sarala, you'll be next.
Okay, so something that I've been thinking a lot about in working in this field is that I think we often think that something that I know from outside the maternal mental health is the same here, meaning anxiety in the general population is the same in the maternal reproductive mental health world, or depression there is the same here. And I think for us, for the misconception to hopefully be clarified of these diagnoses and mental health challenges can look very different, and to be aware that the symptoms, the presentation, the treatment, that just because it doesn't look like that person who has depression or anxiety or whatever it might be, doesn't mean that that's not what we're dealing with. And to kind of really find the sources of support that can give you the support that you need where you are in life. And, people that specialize in the field and can really provide the necessary support.
Yeah. Oh, love that. And great promotion for the team because every one of us is trained very specifically and extensively in perinatal and reproductive mental health. Sarala, what about you?
I think the idea that you're gonna find someone that's struggling the exact same way in the exact same situation. I think accepting that we're all unique, we all have different partners, different supports, different incomes, different dynamics. And once you could accept that, then the comparison game and well, they don't know what I'm going through, or this person doesn't know what I'm going through. I think accepting that your story is unique to you, even it is a shared experience for women, but you're going to have your own path to healing. I think.
Beautiful. Thank you, Gitti.
Okay, so I think I'll be a little bit more specific. I think that, well, overall, actually, I think that people think that just because you have a healthy baby, you're supposed to be happy. And it should be just a time of joy and only gratitude. And if only I would be more grateful, things would be better. But I think every single woman might have the joy and all the other things that come along with it. So we're all in this together and we need to, experience both sides of the coin. So that's one point. And then just to get more specific, I think many people think that if they had a hard time postpartum or if they didn't bond with their babies, they're doomed forever, or there's like an attachment wound forever. And that's so not the case. I think as, when mothers repair and they get healthy again and they feel stronger and better, there's always time, there's a lifetime of bonding and attachment and joy and to create a wonderful relationship. So nothing's happening. It's not scary. It's part of the journey and just hang in there because usually
And get
it's just
good help.
and
And
get
get
some
good
help.
help.
Good help, exactly.
Good help,
There's help out
exactly.
there, get help, and yeah,
Can get better.
things
Yeah.
will, hopefully it will pass.
Hannah, go ahead.
Yeah, kind of, echoing what Talia said, kind of like brought up my own point, which was a woman is one of the most powerful creations, a woman postpartum especially. And when, you speak to like Talia's point of like anxiety, depression, and other psychiatric diagnoses, right? They look so different in the postpartum realm. And someone who looks really great on the outside, I think that that's what we see in the therapy room is giving the client the space to show up as who they really feel at the moment and what those struggles look like. And that's not an indication of a lack of strength. That's actually extraordinary strength. Dealing with postpartum struggles is unique, very unique to the woman. And I've had a client say to me, like, I didn't know there was a whole field for that. And when she said that, that kind of highlighted for me the whole misconception of maternal mental health, which is like, yes, there's a field for it. We name these things, we treat these things, and we treat them in a way that is special and different.
Yeah. Perfect. Perfect. Suri, go ahead.
Yeah, so I second what Gitti was saying. I had similar thoughts in terms of how mothers feel about their experiences, but also to add that, and I think in general, a misconception that I see in general in terms of mental health is where people identify as their struggle. Like if someone is depressed, they see themselves like as they are their problem versus they have so many other parts to themselves. And this is a part that they might be having a hard time. And versus that becomes the whole self and identifying their struggle as the self.
Perfect. Absolutely perfect. Dubby.
I mean, everybody sort of said everything that there is to be said, but just to kind of add, I think I find that so many people put so much pressure on the connection and emotional relationship with their babies. And what I always like to invite them to recognize is that the only thing that needs to be met right now are the baby's physical needs, right? We look at the stages of Erickson, trust versus mistrust. Are you feeding the baby when it's crying? Great. You've accomplished exactly what you need to do right now. And I think there is such an emphasis on, but I need to show up for them emotionally. It's like, they don't need that right now.
Just feed
right
them.
Now what they need. Yeah, exactly.
Awesome. Shifra.
Or even just make sure they get fed. The misconception that I want to share is
wait, say that, slow down. Or just make sure they get fed. I think I love that you just clarified that because you're right. It might not be the mom who's able to feed them at that moment in time, but if they are being fed by others, then you also are caretaking the way that they need to be taken care of. Mic drop. Go ahead, Shifra. We got 2 minutes left.
Okay. Taking medication is not a moral decision and it's not a moral reflection. It can be a life-saving tool. It could be neutral. It's not a moral decision.
Beautiful. Kaya?
Two things, two comments. One is I want to piggyback off a little bit of what Gitty said about the happiness and what we feel after giving birth. That I know that I have many, many clients that have said this to me that I had struggles to have a baby. I went through IVF, I had fertility issues. I should be happy. Why am I not happy? And I think that's a very important point that it's not I should have, I shoulds, right? I think Hannah's mentioned the shoulds, I should not. These are the expectations that you kind of have to throw out the door. You got to throw all expectations out the door because in this moment, it's about you, it's about your baby, it's about your family, and it's all about that attachment. And I just want to say that maternal health is such a broad, there's so much to it. It's not just, okay, prenatal, postpartum, that's it, I'm done. There's just more categories in it, and every single woman goes through each aspect, and it doesn't matter which aspect they go through. I just want to say, you are not alone. There are people out there that can help, can support, that have been through similar, you're unique to your own, but you are not alone.
Yeah.
There are people out there.
Thank you. Thank you, Kaya. Yaakov, take it home.
I think last time you asked me this question, I probably mentioned that men also struggle and that postpartum depression isn't always, someone completely dysfunctional and not able to get out of bed. And I think the misconception I would like to dispel this time is that this is not that uh, postpartum and anxiety and depression are not you problems. They're not her problems or his problems, that they're our problems, that they are the challenge that a family goes through together and a couple goes through together, and can be solved together. And that oftentimes is the core of being able to navigate these challenges together.
That's perfect. I want to thank each and every one of you for everything, for being a part of this. I love all of you. I really do. And I'm honored and proud to be to have each of you part of my team. For those of you who maybe didn't realize that we have a whole team of therapists, really highly skilled and trained therapists, reach out to through my website, dvoraentin.com, to reach out to the very highly skilled and licensed professionals that we have available. With most of you have some availability left. It has really been a treat to spend the morning with you.